Hello, everyone. I hope you're safe and healthy. Thank you for joining us tonight and taking time out for this presentation, which is part of the Lamsa Wednesday webinar series. My name is Zouki. I'm a Lamsa ambassador, and I'm also a student representative and medical student at the USAC School of Medicine and Medical Sciences. So as I said, I'm very passionate about the topic of mental health because I truly believe that awareness, education, and sharing your own story are the key to building kinder, braver, and inclusive communities. And that's why I joined Lamsa. Well, Lamsa is the Lebanese Association of Medical Services for Addiction, which is an NGO founded in 2013 by Dr. Zainam Karzai that aims to foster medical education and awareness of addiction, mental health, and well-being issues while fighting the stigma around those diseases. So our vision at Lamsa is to strive for a healthy and fruitful society by investing in the promotion of the health and well-being of young people. Before we start, please keep in mind that your microphones are automatically disabled for the whole webinar. And in case you have any questions, so kindly raise your hand. At the end of the presentation, there's a feature on Microsoft Teams, and I'll enable your microphones and try to answer your questions to the best of my ability. So thanks again for tuning in. It's so great to have you guys with us tonight. So as you know, I'll be presenting a very interesting but underrated and misunderstood mental disorder called somatic symptom disorder. Unfortunately, this mental illness is very underdiagnosed, despite it being very disruptive and very disabling for the patient. As for the webinar's outline, we'll be covering the essentials regarding the disease, like the signs, causes, diagnosis, and treatment. First, the introduction. Okay, so we all know that medical conditions will almost always lead to physical symptoms, like asthma, for example, can cause shortness of breath and wheezing. We also realize that mental disorders, such as depression, schizophrenia, and anxiety disorders, can and will almost always result in psychological symptoms, like mood changes, unwanted thoughts, or really disturbing emotions. We should also note that medical conditions can in fact manifest in psychological symptoms, like people with diabetes, cancer, or autoimmune diseases can get symptoms of depression or anxiety, and they can even develop a full-blown psychiatric disorder because of their debilitating medical condition. And finally, mental disorders can also manifest in physical symptoms. For example, a person with generalized anxiety disorder can have symptoms such as digestive issues, headaches, and sleep disturbances. So I want you guys to really focus on this red arrow, because for some mental disorders, this becomes a really big problem. And this is where our topic will be oriented tonight. So in our case, we'll be covering a mental disorder that causes very alarming symptoms that will eventually affect the patient's quality of life. But before, what does SSD, aka somatic symptom disorder, looks like? Now, let's take the case of Karim. Well, he's a very passionate medical student, and he's very athletic and hopes to be on his university's basketball team in the near future. So obviously, Karim should be very healthy. But actually, he's complaining of a non-stop shortness of breath for 8 months now, despite visiting many doctors. And all his tests came back normal. He can't focus on his study anymore because of its symptoms, and his performance in basketball is declining very fast. Well, besides that, he only had a history of anxiety and depression in his early teens. Plus, his family is known to have a history of lung cancer because of smoking and genetics, and at all age, not at his age. Yeah. Our second case is Jana. She's 34, a banker, and a newlywed. Her medical history is clear and clean of any significant illness. There's nothing. But we don't know much about her childhood because she always refrains talking about it. What we do know is that she currently has severe sexual symptoms, such as pain during sexual activity, loss of sexual desire, and extremely painful periods. Well, okay, that's weird. And our third and last case is Stephanie. Stephanie, well, she's a high school student who's been through very tough times in her childhood due to the divorce of her parents. She learned how to pick herself up and became an A+ student at school. But a year ago, she started experiencing unexplained changes in bowel habits, like alternating constipation and diarrhea. It was very disruptive, and it made her feel very, very anxious because she couldn't stop fixating on her unusual bowel movements. So we just talked about those three cases, but what does our three friends have in common? Well, obviously, they suffer from a very exhausting disorder that apparently does not originate from a medical condition. Well, to sum up these three cases and try to understand what happened with our patients, let's read together the definition of somatic symptom disorder. So SSD involves a person having a significant focus on physical symptoms that results in major distress and or problems functioning. So the individual has excessive thoughts, feelings, and behaviors relating to the physical symptoms. I'll explain more. So the pain a person feels are related to psychological factors, and it can be traced to a specific physical cause, and that's the main problem. Now for the mind-body connection, well, everyone experienced it. Mind-body connection is the back and forth communication between our brain and body, that involves the spinal cord and electrical and chemical messengers. And we should know that all emotions has physical part. For example, we tear up when we are sad, and we breathe faster when we are afraid. مثلا, Karim, Jana, and Stephanie are constantly worried about their health, and are obviously not faking it, because the pain is very real, the concern is very real. So this is where the mind-body connection, there's a dysfunction in it. There's no cause. no medical cause, at least. And please keep in mind that everyone experiences somatization. Relax, we all somatize. But for some people, it gets in the way of everyday life, and it might require some form of treatment. Now, this mental illness is classified in the DSM-5 under the somatic symptom and related disorders, which include other mental illnesses like body dysmorphic disorder, factitious disorder, and conversion disorder. The thing is that they all manifest as physical symptoms that cannot be explained fully by a medical condition. But there's an additional disorder in the somatic category that catches our attention, which is the illness anxiety disorder, because it's very, very similar to SSD. Well, to compare them, well, they were both called previously hypochondriasis, and they fall under the same section in the DSM-5. But the difference is that, generally speaking, people with somatic symptom disorder do complain of physical symptoms that may cause a lot of distress. But people with illness anxiety disorder usually do not have physical symptoms. Or if symptoms are present, they are very mild. So it's not the major problem. So they only have an irrational fear of developing a disease. So in conclusion, those two are very common and are both very disabling, but the lack or presence of symptoms can do the difference between them. Now for the signs and symptoms. Well, obviously, people with SSD starts feeling weird, unexplained symptoms, like Amjad, like any symptom, you name it, they can feel it. They can report one or more symptoms ranging from mild to severe. And most of the time, as shown in the slide, the first symptom, the major complaint is pain. It's the most commonly reported symptom, and it can be felt in many areas in the bodies like the chest, the arms, legs, joints, back, and abdomen, for example. A patient can also experience neurological symptoms such as headaches, dizziness, movement disorders, and even fainting. Digestive symptoms such as abdominal pain, diarrhea, incontinence, and constipation. Sexual symptoms can be present. We can also have, for example, other symptoms, more general symptoms, such as shortness of breath or fatigue, for example. And please keep in mind that the symptoms are not related to any medical cause, I repeat it. Or if a patient has already a medical condition, such as cancer or heart disease, the symptoms, if he has SSD, are way more significant than what's usually expected. So the patient will undeniably have intense anxiety and negative thoughts and behaviors that can include the constant worry about potential illness or viewing normal physical sensation as a sign of very severe physical illness. We should also note and never forget that this is not a 1 or 2 day thing. So the symptoms can last many months, which causes a state of chronic stress and alertness in the patient. And this will subsequently lead to a more severe impairment than is usually expected from a normal medical condition. Our fourth point in this slide is the low trust in a doctor's diagnosis and treatment. And this is a major problem with patients suffering from SSD, because they feel that medical evaluation and treatment have not been adequate. And that's why they frequently visit that GP many times, and even they go on to visit multiple medical professionals. So it's sometimes very costly. And it can be very difficult for patients, by the way, and families to hear that their child's symptom is related to somatization, because again, the symptom is very fake. The symptom isn't fake, but the patient isn't faking. Finally, a patient with SSD is compulsively and repeatedly checking his or her body for abnormalities, like a lymph node, an unusual heartbeat, a spot on the skin. Is it melanoma? C'est quoi? He doesn't know. Oh, and by the way, to make things harder on the patient, studies show that SSD fighters are very sensitive to medication side effects. يعني دغري بيحسوا بالside effects as if they were waiting for the symptoms to happen. Now, this cycle illustrates a simplified version of what a patient with SSD constantly experiences. First, the patient is very anxious about a certain symptom. For example, he complains of an alarming chest pain. So the next step is that the patient will have to go to his doctor and try to seek reassurance regarding the symptom, to check if he might be suffering from a heart problem, for example. So the physician will auscultate the patient and will find nothing too alarming. But the patient is convinced that something is wrong. Like, doctor, أنا أكيد في مشكلة. خلينا نعمل كل شيء الفحوصات على صحة السلامة. So the patient will undergo an ultrasound, for example, an EKG, and the blood test. And spoiler alert, they all come back normal. Okay, so no medical condition was found. But the problem is that the symptom is still here. يعني ما في illness, but doctor is still bothering me. What if my doctor isn't very skilled? Or what if the test isn't very reliable? And that's when the anxiety rush kicks in again. And this will continuously haunt our patient, and will then be starting a new vicious cycle over and over again. For the causes, a person is more at risk of developing this disorder due to many factors. For example, genetic and biological factors such as an increased sensitivity to pain, or his family has already a history of a certain disease. Second point is family influence. So we mean like how our patient was raised, which may be genetic or environmental or both. Third, a personality trait of negativity, for example, can impact how you identify and perceive illness and bodily symptoms. So if a person already has a negative outlook on life, well, they won't process the symptoms in a normal and positive way. So everything will be alarming, and it's automatically a great danger. لو شو ما كان السيمبتوم. And last point in this slide, having a problem with processing emotion. So this will cause the physical symptoms to become the main focus rather than the emotional issue. يعني if an emotion or trauma مثلا, it was suppressed and wasn't dealt with correctly with therapy, for example, well, it's going to show up anyway in the body. And in our case, it will show up as a physical symptom. Also, people who abuse of drugs or alcohol are more at risk of developing SSD. Same for people who experience physical and sexual abuse, common childhood trauma, or having other psychiatric disorders such as GAD, aka generalized anxiety disorder, or PTSD, where it can put you at risk of having somatic symptom disorder. Okay, amazing. So لنغير جو شوي. It's time for some random facts regarding the disorder. هيك شوي culture general. You should know that it affects women more than men. So women are 10 times more likely to be affected than men, to be accurate. SSD is fairly common as a disorder, but it's very underdiagnosed, as I said at the beginning of the presentation, affecting up to 7% of the general population. And did you know that, in fact, up to 12% of visits at a doctor's clinic are for somatic symptoms, which isn't at all a small number. And that's why a healthcare provider should always keep in mind that etiologies aren't always organic, because somatization is fairly common. And now for the last section of our webinar. To determine a diagnosis, you likely have a physical exam and any test your doctor recommends. Your doctor or other healthcare provider can help determine if you have any health conditions that need treatment. And when the results come back as normal, the doctor might further assess the possibility of a somatic disorder. So he will check for your risk factor, if you have any risk factor of SSD, if the symptoms are not explained. Now, for the second step, your medical provider may also refer you to a mental health professional who may conduct a psychological evaluation to talk about many things like your symptoms, your fear, concern, family relationships, childhood, like everything. So here, like you can read in the second rectangle, you can see the point that the DSM-5 focuses on in the diagnosis of somatic symptom disorder. So first, if you have one or more somatic symptoms, for example, pain or fatigue, that are distressing or cause problems in your daily life. Second, if you have excessive and persistent thoughts about the seriousness of your symptoms. And if a lot of anxiety is given and you devote too much time and energy to your symptoms or health concerns, so this is a point for diagnosis. And typically, the feeling should persist for more than 6 months, even though the symptoms may vary. And ما بيضلوا كل وقت shortness of breath, or vomiting, or fainting. It can change. But more than 6 months, we can think that it might be SSD. And most importantly, never self-diagnose. I know that some of you might relate a lot to this topic. Like, if أنا أكيد هيك دايما بحس وعندي هالسيمتوم وبضيق نفسي ومدري شو، أكيد عندي SSD. And that's okay to think like that. But as I said before, we all somatize. And it becomes a problem when we can't function normally because of it. And it shouldn't get in the way of our daily life. And talking about do not self-diagnose, I know that, Kamena, that most of us had a consultation with the world's most famous, or shall I say, infamous doctor, which is Dr. Google. I always imagined, if Google had a clinic, their slogan would be turning all your harmless headaches into brain tumors since 1998. أكيد you can Google stuff like about how to take care of yourself. If you have a minor thing like a common cold, migraine, a well-controlled benign condition. Now, إذا بتفتشوا على those online health information, it can help you take the right decision sometime, or some OTC treatment. You should know at least what condition you have. Or you can go and refer to your doctor. It's better to go to your doctor if anything bothers you, because most of the time while consulting Google, you can either overestimate or underestimate your symptoms. أصلاً who am I to judge? We all Googled our symptoms before, but it's better not to. لأنه most of the time it's not worth it at all. So it might, as I said, delay real help because you underestimate your symptoms, or it will just freak you out for nothing. For the next slide, For the treatment, of course, the diagnosis of SSD is not the end of the world. So the light at the end of the very symptomatic tunnel isn't that far. And the physical symptoms are related to high level of anxiety, and that's why psychotherapy, and specifically CBT, cognitive behavioral therapy, is very useful. Because CBT, it helps a lot the patient to learn how to reduce stress and understand his or her emotions and learn how to cope with those physical symptoms. And that's great news because it's very effective. Also for the medications, antidepressants can help reduce symptoms associated with depression and pain that often occur with SSD. We have a lot of kind of medication. It depends on the stages of SSD. Lifestyle changes can help, like incorporating mindfulness techniques or body scan meditation. And by the way, body scan meditation, super intéressant because it involves paying attention to the parts of your body and bodily sensation in a very gradual sequence, يعني مثلا من الراس للإجر أو from feet to head with zero judgment. So it helps you accept your symptoms, and it's also very helpful. You can do this at home. You can find the YouTube video about a guided body scan meditation. Also, a patient should try to get physically active because it has a calming effect on his mood, and it can improve the patient's physical symptoms and help improve his overall physical function. Sorry. And we also advise the patient to stay involved in his or her work and in social and family activities. We shouldn't wait for our symptoms to resolve, to participate in anything in life. بالعكس, it's therapeutic to go out and participate in activities. Like, for example, you can come volunteer with us at Lamsa. People here are very kind, and the impact the Lamsa family has on the society is amazing. With such activities, you can help yourself as a patient or help other people. And finally, substance abuse can make the general care more difficult, so it's better to avoid them. It's better for the patient to avoid substances. I really love this quote. It's the kind of a mantra for people with SSD and also for each one of us. So Epictetus, the Greek philosopher, said, "It's not what happens to you. What matters is how you react to it." Donc, ce n'est pas la situation qui compte, mais pas ta réaction à la situation. I love this quote. Okay, so before I start answering your questions and listen to your comments, please allow me to thank Dr. Zainam Karzil and Diane Ghanem for giving me this opportunity to speak up and talk about a subject that matters a lot to me. So thank you for your trust and kindness since day one. I'm very grateful to be part of the teams of wonderful ambassadors that are trying to break the stigma, and we are doing it, not even trying, to break the stigma around mental health and addiction problems. Okay, so any questions or comments? So please, as I said before, raise your hand so I can enable or unmute your microphones, please. Oh, okay. I think, yes, we have a question from Perla. Yes, Perla, تفضلي.
Christian, you were talking in the DSM-5 diagnosis, which diagnoses these disease disorders. You mentioned, I think, illness, anxiety, but there were many others, like the conversion, maybe. Can you please explain a little more? It seems very interesting. I didn't really understand what's the relation.
Deal. Okay. So أول شيء, thank you so much for your question. لأنه أنا مرقتهم بسرعة لحد ما كثير ضيع وقت فيهم قلت. بس رح أرجع أقول سريعا كم واحدة إذا شيء. So إذا بتذكر منيح, we have conversion disorder somatic symptom disorder. هو it's more like neurological symptoms. كمان السيمتوم مثل ما قلت هول كلهم related to symptoms. The problem is unexplained symptom, بس هالمرة it's neurological but a loss of function. البيشنت بيكون عنده paralysis, عنده blindness. فمثل ما قلت the cause is psychological, but we don't have pain like SSD. It's more of a loss of function. مزعجة خبرية And في كمان factitious, this one is very interesting. لأنه the person, unlike SSD, and SSD, it's unconsciously the patient is here, the symptom, sorry, is here. But for factitious disorder, the patient fabricates or exaggerates the symptoms. And for example, I read a study where patients induced vomiting or even falsified medical tests because of the gain because of the psychological gain. يعني فاكرين هن بيربحوا شيء منه psychologiquement. They exaggerate or fabricates symptoms. Okay, did I answer your question?
So he perceives himself as having the symptoms, or he presents himself as being ill when he's not really that way?
100%. Yes. هو بيخترع السيمبتومات بالfactitious disorder. So it's voluntary, not involuntary like SSD. Okay. Any more questions? Okay. So I'll proceed. So, guys, my final recommendation for you as a Lamsa ambassador before the end of this webinar is to try to be a bit kinder, compassionate, and tolerant with people around you. Because as you know, there's an ongoing mental health pandemic in the world. And the only thing that is free and harms no one is awareness and kindness. So I urge you to talk about mental health from time to time. And there's one way to do it is by writing and interacting on our online forum at Lamsa. So you guys can share your own stories and experiences, anonymously or not. So like that, we can help heal people around us indirectly and help each other in building a brave and resilient society. So thank you so much for attending and have a nice week. Thank you. It was lovely to have you guys.